Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today my guest is Scott Miller. He aims to help you with your health goals of healing, pain relief, increased mobility, and overall health. He and his staff can assist you with workouts too, ensuring that you're not subjecting yourself to aggravating an injury or jeopardizing your healing. Now, I want Scott Miller to tell you what a PT does and why he is one of the best people who does this in Florida. I want to welcome to my show Scott Miller.
Well, thank you, Susan, for having me on your show, and I do appreciate the time to give some information about my practice and just about physical therapists and who we are. Mm-hmm. Physical therapists are licensed healthcare professionals who help patients reduce pain, improve, and restore mobility, oftentimes without having to go through expensive surgery, and reducing the need for patients to be on long-term prescription medications. Mm-hmm. We also try to restore a patient's or individual's function and really try to prevent disability. And we cater to an individual's needs and develop a program specific to the specific client or patient that comes into our office.
Mm-hmm. Now, you work with people of all ages, and sometimes you work with young people, sometimes you work with elderly people. Now, which person or which group seems to need the most physical therapy?
In my experience of my practice here in Delray Beach, Florida, we do have a majority of patients who are in the baby boomer generation, the individuals who want to try to keep as active a lifestyle as possible as they are getting older. The active individual who likes to be part of a walking program, tennis program, golf program, and just needs to stay fit and stay strong. And we are here, in case there are injuries.
Now, Scott, so many people, particularly in Florida, because it's a retirement state, they play golf, and golf can be a very rough thing on the body. Don't you agree? And if so, give our audience a taste of what kind of therapy you give to a person who plays golf and comes in and says, "Oh my God, my back is killing me, my spine, everything I feel is just achy and achy." Do you tell them that they should continue to play?
Absolutely. Our main goal is to keep someone on the golf course in a safe manner. And to, if they are unable to continue playing, then our main goal is to try to get them to return to their level of activity as soon as possible. So that's the number one goal. So, basically a program would consist of having a patient come in for their initial evaluation to see exactly what might be going on, because golf does put a tremendous amount of forces on the lower back, on the hips, on the knees, even the wrists and the shoulders. So we do have to assess, the actual body part that is being aggravated with the golf playing, and we would establish a physical therapy and fitness and stretching program for that specific patient. Sometimes a little change in their the swing mechanics, or getting them on a nice stretching and strengthening program can get them back, as soon as possible. And then in other cases, they do need to, take some time off of the game to go through a little more of a rigid physical therapy program where we're doing a lot of hands-on work and modalities for their specific treatment.
Mm-hmm. Now, kids do almost anything. I mean, they have you know that kids will just try anything. They'll go on all these different equipment that takes them up in the air, swinging back and forth, doing all kinds of, well, what I would consider crazy things. Now, do you think that kids should see you before they absolutely do these just amazing things with their, and I'm trying to think of the board. They do something with a rollerblade, and what do you tell these kids and their mothers? Do you tell them that they should be using their sense of what hurts them? Because they never hurt. They'll do anything, right?
That is true. As the young children and adolescents, their bodies are very resilient. They're very flexible. Their muscles are developing. So usually we do. We're not going to see the younger client until something does happen. But for the young children that we do see here for injuries and getting them back to doing activities like that, we really want to make sure, and we educate their parents on the importance of mobility and strength and safety, because safety is really the number one cause of injury in children. It's when they're doing something that is unsafe and that probably should not be done or should be done with supervision. When these activities are done under supervision and proper precautions are taken, that greatly reduces their risk for injury. So education is really the number one way to really reduce these injuries.
Now, if you were standing before a group right now and you were just giving them an overall, a general kind of idea of what PT is, pretend for me. Just give me a scenario that describes what you would discuss with your audience.
Well, it depends, what audience I'm going to be addressing. Are we addressing the children, adolescents, your young adult, or your baby boomer, or even your elderly senior patients?
Well, let's start with the baby boomers, because a lot of our audience are baby boomers.
Okay, so with the baby boomer population and how vast and large this population has become, we have become a much more active society. So in order to continue with this with the activity that they've been used to over the last let's say 10 or 20 years of their life, we really want to address the importance of movement, mobility, flexibility, and then, of course, strength. Those few aspects of fitness will really help reduce their risk for injury, and then, of course, reduce any pain that they may induce with these activities that they are performing, and of course to prevent any future injuries.
Mm-hmm. Now, Scott, what do you think about people who take different kinds of medications for these kinds of injuries, such as tendinitis or bursitis or many of these other injuries you mentioned in your bio on your website? Now, a lot of these people, they get shots. It's cortisone shots. They take all kinds of vitamins, everything to try to kind of help them out. Do you believe in that?
Well, there is a time and place for medication and for cortisone shots or for supplemental medication or vitamins. I think anything by itself, it really depends on the actual specific case and what exactly is going on with that individual. So if someone is experiencing a moderate amount of inflammation, there are a lot of holistic type of medications and vitamins that do indicate that they do reduce swelling. Cortisone shots can be beneficial to help reduce inflammation, help reduce pain. But it does not fix the actual problem that's at hand. So if a golfer is experiencing the golfer's elbow or a little tendinitis in the elbow or shoulder, a cortisone shot may help reduce some of that inflammation. It may help with the acute pain that they're experiencing, but by no means is it fixing the issue that initially caused this tendinitis. So as physical therapists, the cortisone shot may help them tolerate the physical therapy and the exercises a little bit more, which ultimately will help them return to their normal function and prevent that tendinitis from returning. Right. So it's very important to get them on a good strength and stretching program along with this, any anti-inflammatory medication or shots that they do receive.
Now, swimming is something that I love, but and I find that when I swim, I do a lot of stretching in the water, and it just feels fabulous. Do you recommend swimming for most of your patients?
Absolutely. Swimming is a wonderful activity, especially down here in South Florida in the summertime in this heat. It's a great way to get some good cardiovascular exercise without the risk of overheating too much because of the heat and the humidity down here. However, swimming does require a good amount of flexibility for not only your shoulders but your neck and your lower back. So if an individual does experiencing some pain in the shoulders, back, or neck while swimming, most likely they need to be part of a nice stretching program to improve this. But swimming is a great activity. Also, it does the buoyancy effect of water. It decreases the pressures and the weight that's put on your joints. So it is much easier on your joints to do an aerobics class or a walking class or just or swimming in a pool.
That brings up a couple of things in my mind. One is that a lot of people today are doing yoga. They're doing Pilates. They're doing all kinds of things with trainers. And, sometimes these trainers push them to a real point of exhaustion. Do you think that that's a problem, and would you recommend to your patients to do the yoga, the Pilates, or go to a trainer?
Well, it is all patient and individual specific. So, a good athletic trainer, a good personal trainer, and a trainer that actually knows the individual, it can be very beneficial to get them on a very good training program. You always want to be cleared by your physician before you start with a personal trainer, and before you are actually, exercised to exhaustion. Right. Yoga and Pilates are two outstanding exercise type programs that do work on flexibility and strength, and try not to use heavy weights to achieve these goals. So yoga and Pilates are two excellent exercises and programs that we actually incorporate in physical therapy as well with some of the movements that we do. But again, a patient or client needs to really be educated on their personal trainer, with what type of certifications they do have, and with the experience that they have working with certain individuals, because the trainers do not have experience with injuries specific to the body. So you just have to do their due diligence with what type of program they're going to start.
Now, we've been talking about people who are very active, people who love to do all different kinds of sports. But what about the couch potato? The couch potato usually is a little overweight. They have some problems with their backs, their spines, their various other places in their body. Now, if somebody comes to you who's a couch potato, what's the first thing you recommend?
That is not uncommon at all. The majority of this society is not active, and we do see quite a few clients and patients here that have been sedentary most of their life and are very inactive. And our first goal with them is to is just to get them moving, is to get them off the couch, is to get them walking, and everything needs to be started incrementally. You have to start everything nice and slowly, and you get somebody motivated to start a program. And you also have to address it not just on a mobility or an activity level, but you have to kind of see the whole picture. You really have to get a whole health perspective of a patient. So you have to, talk to them and speak to them about nutrition, about any underlying pathology or diseases. So getting in with a primary care physician for a blood workup and a whole nutrition analysis is very, very important, so that you can really get this patient on the right track with diet, movement, exercise, and then progress them into a really good program.
Mm-hmm. Now, Scott, I want you to take us through this procedure that you do from the beginning of when someone walks into your office. Say it's me, okay? And I tell you, I say, listen, Scott, I have a rotator problem, and how do I know whether it's a rotator? But I feel pain in that part of my body. So I come into your office, and this is a complimentary consulting session. Start off with the questions that you ask me.
Well, first, that's probably the most important part of the first treatment is the history taking and the evaluation portion of getting to finding out exactly what's going on. So the most important really is to find out the mechanism of how this pain started, when it started, if a certain activity caused it, if it's because you're overusing the shoulder and the rotator cuff, if it's an old injury, if you have had played a sport and you've had some issues in the shoulder for years, or it's something really acute and you heard it and you felt something on a specific day and time, can really narrow down and kind of give us a really good answer on what exactly is going on. I will also try to find out if you've been to any other healthcare provider, if you've had any diagnostic tests to either rule out certain pathologies or actually diagnose anything specific in the shoulder.
Mm-hmm. Now, a lot of the people today travel. It's kind of when they go on airplanes, it's kind of like a bus. It's very small, and they are in a small space, and sometimes they have to sit there for hours. Is there exercise they should be doing to avoid any kind of problem?
Absolutely. We have patients all the time that either travel quite often in airplanes or in cars doing quite a bit of driving with their to their workplace or on certain jobs, or you're sitting at a desk for hours at a time. So it all goes back to trying to increase the mobility and increase time that you're actually staying active. So if someone is traveling a lot and doing a lot of sitting on an airplane and they're developing a lot of stiffness in their knees, there are certain exercises and movements that can be done right at your seat, or just try and instruct someone to, try not to sit for more than 30 or 45 minutes at a time and, get up and just move around a little bit. And that goes the same for someone who sits at a desk and is on the phone for hours on end.
Now, there are certain gadgets that people use today. People who work for many, many hours, there are people who spend about 16 hours in their offices, and now they've come out with different kinds of equipment that you could just stand and you can exercise while you're on the computer. It seems very innovative, but does it really help? Do you know about that?
Absolutely. There are a lot of products out there that creates a desk environment, let's say on a treadmill, or you have desks that go from the height of a seated position, and with a touch of a button can go all the way to the height of the comfortable standing position. So if the position of your workstation is in proper alignment, and there is certain alignments that is necessary for good posture, different positions throughout the day is ideal. They also have the seat that you are sitting in throughout an extended workday is very, very important too. And there's been a lot of new products out there that try to keep your body in the best anatomical position while you're sitting for this many hours, which helps reduce some of the pressures that are put on the nerves and put on the joints of your hips, knees, and lower back especially.
Right. Now, if you were to write a book, what would you say in the prologue? Is there something that you would tell our audience or the people who read your book, something unique, something that they ought to know that not too many PT people or others are telling their patients?
Well, that's actually that's a great question, and if physical therapy is so vast, and there's so much information out there on physical therapy. So if I was to write my first book, most likely it would really try to educate in layman's terms what a physical therapist does, who we are, and who can benefit from physical therapy, because a lot of people do have the assumption and belief that physical therapists are only there for, if someone does get hurt and if you have surgery. But in actuality, physical therapy really is best suited for someone who really wants to try to just improve their overall function, if they want to prevent disability and just to stay fit and stay strong.
Yeah, that's good advice. Now, one other thing that I'm curious about, again, we were talking about equipment that's made for people with different back problems, different PT issues that really cause them to have aggravation to the problems in their physical being. So they make special chairs for one's body. And I'm just wondering if you think that is important for them. Are they trying to just sell things to people and with a vague kind of idea that it's going to help them, or is it true? I mean, are there equipment out there to make them feel good?
Well, most of these products and a lot of the chairs out there that are made for good posture and comfort don't always, are not always gonna fix someone's pain if they already have a lot of lower back pain. A lot of these are made for the preventative purposes, to help promote good posture, to help prevent you from sitting poorly, so that you don't have back issues in several years from now. So if someone has severe back pain, just buying a product like that, it does not always, guarantee that you're not going to have back pain anymore. So that's certainly an important aspect. But a lot of these products are made by physical therapists and designed by PTs who keep that posture and the proper ergonomics and mobility in view.
So you're talking, that's the word I was looking for. It's the word ergonomics. Define ergonomics for our audience.
Well, ergonomics is is how your whole workstation and your posture is set up. So ergonomics, if I was to do an ergonomics assessment, then I'm going to kind of see how comfortable, how their posture is set up at their workstation. So it's an ergonomic setup is really intended to provide optimum comfort and to avoid stress on specific body parts.
Mm-hmm. Yeah, that's an interesting point. Now, last but not least, the idea of a physical therapist makes a lot of sense to me because, again, you're doing everything you can to reduce pain, to prevent all kinds of problems. But what about a chiropractor? Is there any relationship between a chiropractor and a PT?
Well, in some cases, a chiropractor and a physical therapist can work hand in hand with certain patients. I know that a chiropractor does specialize in the lower back and the spine, and they do work on proper alignment of the vertebrae and the spine, and as well as the extremities. And and physical therapists are really going to be looking at the long-term picture of fixing a specific issue and getting them on the right program to prevent anything from reoccurring.
Mm-hmm. That's interesting. Now, let me tell you this. I often ask my guests to give us the last word because you know so much about what you do, and I think our guests would like to hear how you would just treat the whole thing, everything that you think about. I'd like you to give us the last word. First, and I must say to you, Scott, if our audience wants to go to Scott Miller, do you have a website? Is there some way they can know about you? How do they find you?
Absolutely. We have a very, very interactive website, and my website is www.miller-pt.com. That's MILLER-PT.com. We have lots and lots of, we have thousands of educational articles and descriptions of specific injuries and treatment methodologies, and a lot of really good articles on pretty much the entire human body. We also have a lot of information about who we are, where we're located. We also have a store on the website where physical therapy products can be purchased, and any other a good link to contact us via email if there are any certain specific questions either about physical therapy or about our office in general.
Yeah, that's very important. So now, Scott, give us the last word. I'd like to know what is on your mind. And, I just thought of something else that I think is a very important thing for people. We've come a long way with physical therapy and various other modalities, but what do you expect to happen in the future? Is there something happening that we should know about? Because medicine is changing so much. I'm sure that PT is in the same position. So what do you know about the future of PT?
Absolutely. In the last 10 or 15 years, our organization, the American Physical Therapy Association, has been working very hard on creating autonomy in the physical therapy field. And really what that means is we want to be the first provider that a patient may be able to see. We've come a long way. 98% of the educational programs that offer physical therapy degrees now are offering the doctorate in physical therapy, which requires additional years of education. Mm-hmm. And we are becoming, working on becoming diagnosticians and trying to be the first provider, which will really help with healthcare costs and trying to get patients in before they actually get hurt and try to prevent their injuries. So that is certainly a goal of our organization is to have every program is doctorates of physical therapy and to have direct access throughout healthcare.
Scott, I wanted to finish the show before, but there's still one more thing that I think is important, and you just brought it up, and that is if one wants to be a physical therapist, is it a very long and very tedious situation, or can who sort of has the ability to be a physical therapist? Because it's almost like a doctor, isn't it?
Absolutely. It does take several years of education, and it has become very, very, very competitive to get accepted into the physical therapy program. So if someone is interested in possibly becoming a physical therapist, I would advise them to start on our organization's website, theapta.org. There's a lot of good resources and education about what is needed to become a physical therapist. Usually, people who are interested are taking science classes in undergraduate programs, and they are taking the prerequisites which are needed to get into physical therapy school.
Right.
Once all those prerequisites are obtained and your GPA is at the required level, then you can apply for physical therapy school. And so once you are complete with your undergraduate 4 years and you get accepted to a doctorate program in physical therapy, you're going to be in physical therapy school for 3 more years.
So you better be dedicated, it sounds like, because, boy, it seems so difficult. But I'm glad that it's difficult, because we want people who are dedicated to the field and also then are smart. And I assume that you really have to know things, and you're just an example of the type of person we want as a physical therapist. So I want to thank my guest, Scott Miller, who is a physical therapist in Florida, and he has an outstanding team of licensed physical therapists working together to give people an opportunity to feel much better than they do when they unfortunately have an injury or anything like that. So thank you so much, Scott, for being on the Susan Brender Show.
Well, thank you very much for having me on your show. It was a pleasure giving the information that I do have about a physical therapist and about physical therapy in general.
Okay. Thank you so much, Scott.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.